Welcome back to BCBA Exam Prep. In this video, we're covering operant behavior and respondent behavior, also known as operant conditioning and respondent conditioning. This is a high-frequency exam topic and one of the most important foundational distinctions in applied behavior analysis. The BCBA exam doesn't just test whether you know the definitions. It tests whether you can correctly discriminate between different learning processes. Throughout this video, we'll focus on what controls behavior, because control, not appearance, is what determines classification. This topic is heavily tested because it sits at the foundation of behavior analysis. The distinction between operant and respondent behavior is explicitly required in the BCBA 6th edition task list, and it directly impacts assessment accuracy and intervention design. Misclassifying behavior can lead to ineffective or even harmful interventions, which is why the exam places so much emphasis on this skill. The exam is testing your ability to distinguish learning processes, not just label behaviors. Mastering this distinction is critical not only for passing the exam, but for ethical and effective clinical practice. At a high level, there are two primary types of learning in behavior analysis. Operant learning involves behavior that is emitted by the learner and shaped by its consequences. The learner actively engages with the environment, and future behavior is determined by reinforcement or punishment. Respondent learning, on the other hand, involves behavior that is elicited by stimuli. These responses are automatic and do not require a history of reinforcement. Understanding this difference, consequences versus antecedent stimuli, is essential for everything that follows. Operant behavior is behavior that is emitted by the learner and shaped by its consequences. It is voluntary, learned behavior under the control of reinforcement, punishment, and extinction. Operant behavior is central to ABA intervention design and functional analysis, and it is best understood through the three-term contingency. The antecedent sets the occasion, the behavior occurs, and the consequence follows. What matters most is this: consequences determine the future frequency of operant behavior. Operant behavior is voluntary and goal-directed. It is shaped over time through a reinforcement history, and its future frequency depends on what happens after the behavior. Operant behavior is influenced by motivating operations and controlled by discriminative stimuli. Examples include requesting breaks, completing tasks, or engaging in problem behavior to escape demands. On the exam, a key strategy is to look for consequence history. If consequences are shaping future behavior, you are likely dealing with operant behavior. Operant conditioning follows the A, B, C sequence. The antecedent sets the occasion. The behavior is emitted by the learner, and the consequence shapes future responding. Reinforcement increases the probability of behavior. Punishment decreases the probability of behavior. Extinction reduces behavior by withholding reinforcement. The critical distinction here is that behavior is emitted, not elicited. If the behavior changes because of what happens after it, operant conditioning is involved. The BCBA exam provides consistent clues for operant behavior. Phrases like behavior increases after consequence or reinforcement is delivered are direct indicators of operant conditioning. Statements such as behavior is maintained by escape, attention, or access also signal consequence-based control. When you see references to behavior being shaped over time, think differential reinforcement. A reliable exam rule: operant behavior is about what happens after, not what happens before. One common trap is confusing operant behavior with reflexive responses. Automatic reactions like heart racing or sweating are not operant behaviors, even if they follow another behavior. Another trap is ignoring consequence history and focusing only on what the behavior looks like. Not all learning is operant. Some behaviors are respondent and controlled by stimuli. When unsure, always ask, what controls the behavior? Respondent behavior is elicited by antecedent stimuli. These responses are involuntary and reflexive, often involving automatic physiological reactions. Respondent behavior is governed by classical conditioning and does not require consequences for learning. Examples include changes in heart rate, pupil dilation, or fear responses. Respondent behavior is controlled by stimulus pairing, not by reinforcement. Respondent behavior includes involuntary, reflexive responses such as startle reactions or sweating. These are physiological responses that occur automatically when specific stimuli are present. No history of reinforcement or punishment is required for respondent learning. If a behavior is described as reflexive, involuntary, or physiological, it is almost always respondent rather than operant. This distinction is a frequent exam target. Respondent conditioning involves pairing stimuli. A neutral stimulus is paired with an unconditioned stimulus until the neutral stimulus becomes a conditioned stimulus that elicits a conditioned response. The response is automatic and involuntary, and no consequence is required. Once conditioning occurs, the conditioned stimulus elicits the response regardless of the learner's control. This is a stimulus-stimulus relationship, not a behavior-consequence relationship. Exam clues for respondent behavior include phrases like automatic response or involuntary reaction. Look for physiological changes such as sweating, blushing, or heart rate increases. Stimulus pairing language, such as paired with, is a strong indicator. If no reinforcement or punishment is mentioned and the response is reflexive, the behavior is respondent. A major trap is treating respondent behavior as operant. Fear responses are respondent, but avoidance behaviors that follow may be operant. Another trap is looking for consequences when none are required. Respondent behaviors occur automatically and do not depend on reinforcement. Focus on what is being controlled, not on the outcome. Operant behavior is emitted, the learner initiates it. Respondent behavior is elicited, the stimulus triggers it. Operant behavior is controlled by consequences and follows the three-term contingency. Respondent behavior is controlled by antecedent stimuli through stimulus pairing. Voluntary, goal-directed behavior is operant. Involuntary, physiological responses are respondent. This table summarizes the key exam distinctions. Operant behavior is consequence-controlled and requires reinforcement for learning and maintenance. Respondent behavior is antecedent-controlled and does not require consequences. Operant responses are voluntary and variable. Respondent responses are involuntary and reflexive. On the exam, control variables, not surface features, determine classification. Many real-world behaviors involve both operant and respondent components. For example, a child may experience an automatic fear response when seeing a dog. That's respondent. Clinging to a caregiver to escape the situation is operant and negatively reinforced. Accurate assessment requires identifying both components. An effective intervention must address each. Incomplete treatment plans that ignore mixed control are a common exam trap. Operant extinction involves withholding reinforcement for a previously reinforced behavior. Respondent extinction involves presenting the conditioned stimulus without the unconditioned stimulus until the response weakens. The key distinction is this: operant extinction involves consequences. Respondent extinction involves unpairing, not consequences. Confusing these two processes is a frequent exam error. Use a systematic decision rule. First, ask whether the behavior is elicited by a stimulus. If yes, it is likely respondent. Second, look for consequences. If consequences shape future behavior, it is operant. Third, check for pairing history. If there is no consequence-changing behavior, it is respondent. If there is a consequence-changing behavior, it is operant. In this scenario, a child asks for a break, receives the break, and later asks for breaks more frequently. The behavior is emitted by the learner and reinforced by the consequence. There is no stimulus pairing. This is clearly operant behavior, controlled by reinforcement. In the dental anxiety example, a drill sound is paired with pain, leading to fear. The response is automatic, involuntary, and physiological. No consequence is required for learning. This is respondent behavior, controlled by stimulus pairing. This scenario includes both components. The fear response to the dog is respondent. Clinging to a caregiver is operant and negatively reinforced. The correct strategy is to identify both components, then determine which one the question is testing. This distinction ensures accurate assessment and prevents ineffective or harmful interventions. Treating a fear response with reinforcement alone will not address the underlying respondent process. Correct classification supports ethical practice, better communication, and more accurate treatment planning. It is also critical for exam success. Common errors include assuming all learning is operant, misreading reflexive language, and ignoring stimulus pairing. Another frequent mistake is confusing operant extinction with respondent extinction. The exam rewards careful reading and precise discrimination. Operant behavior is consequence-controlled. Respondent behavior is stimulus elicited. Do not confuse response form with function. Mixed control is common. Assess both components in every behavior. To strengthen your exam readiness, practice discriminating between operant and respondent behavior using BCBA-style questions. Always ask, what controls the behavior? Visit www.bcbamockexam.com to build fluency and confidence.